Okay, so we're down to the care coordination performance indicators. In other words, how is it that we're going to measure? What are we measuring um, as a patient transitions to the community to um, truly um, identify whether or not we're meeting the expectations of this improvement in care management? So the first thing I think we will definitely do is um, work with our informatics database, pull the information from our charts to identify whether or not we're conducting the chart review, the pre-screening chart review, and the in-person visits at the appropriate timelines prior to parole. The next thing we'll do is make sure that those in-person visits, we're having two of them conducted, one at 30 days and one at 7 to 14 days. And again, by creating specific and standardized Power Form documentation fields associated with the database that is tracking parole timelines. And if we combine those two, we can definitely have enough data to let us know whether or not these timelines are being adhered to. Um, the other factor we should focus on is create a direct documentation field um, for TCN appointment verification. Uh, this will this will let us know whether or not our patients are truly linked to community providers with an established appointment within this documentation field. Um, it is dependent on whether or not the nurse documents. However, there are other ways of referring back to whether or not that was established, as we do have administrative support analysts that are helping establish these appointments as well. So there is always a way to follow up and confirm that that's happening. The last thing we want to do is measure the time that the parole service agents are entering demographic information into that shared database we spoke about previously. And that's an easy one as well to pull from the database and the shared um, site. The shared site may not uh, be the best. The best place to pull the data will probably be from the parole agent initial um, electronic documentation uh, um, software that they use, and we verified that that can be indeed pulled to give us enough data to confirm that all of this is being done accordingly.